Hello dear friends, hello dear viewers. I hope you all will be fine and doing well. So dear friends and dear viewers, dear audience, in the previous lecture videos I had discussed a very amazing topics of nutritional consideration and prevention and management of gallstone. Plus I had discussed the function of liver and the disease of the liver, and then also I had discussed the dietary management and the liver diseases, especially and the cirrhosis. Now in this video I will discuss the dietary management and fatty liver disease, hemochromatosis, hepatitis C. Plus I will also discuss the role of nurse in the prevention and the management of liver diseases. But here, before I start my lecture video, I kindly request you to please subscribe to my YouTube channel Makkah Memories and press the bell icon to receive the notification of my upcoming videos. Fatty liver disease. Fatty liver disease is the build-up of fat and liver cells. The diet recommendations for fatty liver disease is you should eat limit foods that are high in calories. Eat foods that have fibers. In the fatty liver disease, 11 foods fatty liver foods you should eat, like fish, garlic, avocado, green vegetables, whey proteins, sunflower seeds, which is also called surajmukhi, coffee, green tea, walnuts, which is also called akhrot in our local language, oatmeal, and olive oil. 6 food of fatty livers you should avoid to eat. The 6 food are alcohol, added sugar, salt, highly processed flour, fried foods, and red meat. You should not eat these 6 items when you have a fatty liver disease. And the hemochromatosis is basically the build up of iron in the liver. When iron decompose in a very high amount in the liver, then it will leads to hemochromatosis. So the diet recommendations for the hemochromatosis is do not eat food that have iron, do not use iron pots and pans, do not take pills with iron, do not eat uncooked shellfish. Here I will also discuss the diet, the foods which you should avoid if you have hemochromatosis. Here I will discuss the 8 foods you should reduce or you should minimize the use of this food. The first one is the iron supplement. You should not take the iron supplements if you have a hemochromatosis. High fructose corn syrup or meat, alcohol, fortified and enriched foods, sugary foods, meat, animal fat, and raw seafood and shellfish. You should eat 6 types of foods. Continue to eat, just not with iron, like carotenoids, acidic foods, vitamin C, fermented foods, fruit. Learn more at tailory.com. Hepatitis C. Hepatitis C is a disease of the liver caused by the hepatitis C virus. Hepatitis C is a disease of the liver caused by the hepatitis virus, specifically the hepatitis C virus. The diet recommendations for hepatitis C disease is you should limit foods that have a lot of iron, do not use iron pots and pans, limit salt, and foods that contain a lot of salt. Foods to avoid during hepatitis infection. You should not eat alcoholic beverages. You should not eat stimulants such as tea and coffee. Here now I am just taking tea, but you should not take tea if you have a hepatitis C disease virus. You should not eat hot spices such as chili, ginger, garlic, and if you are going to eat, then you have to eat it in a very limited amount. Refined sugar products are not allowed. Pain relieving drugs such as aspirin, you should not eat also aspirin. Roles of nurse in liver disease. So the role of nurse in the liver disease is basically it provides the empathy and understanding and works with the patient and their family carers, particularly those with chronic liver disease. Support patient and families like carers in their understanding of their condition through patient education and health promotion. Undertake a comprehensive clinical assessment including risk profiling and follow up with appropriate action, including referral to specialists for relevant acute and chronic health care conditions. Assist in collaboration with the patient, family, carers, their healthcare needs, taking into account the impact of their age, vulnerability, their lifestyle, culture, and ethnic background. Develops and evaluates a self-management plan with the patient who has predisposing factors to liver disease. Works alongside and with the protein and family carers to address the psychological and social impact of their conditions. Provides specific diagnostic treatment options safely. Use early warning tools, approaches to identify the patient's changing and deteriorating conditions and take appropriate action. Attacking liver or message. Actually, your liver does communicate with you. If you eat a healthy diet, your liver tells you that you are doing a great job. You get the message because your liver is able to function properly and provided your overall health is good. You feel in great physical shape. If on the other hand you are not careful with your diet, your liver is defenseless. When you consume fatty or fried foods and pile on the salt, your liver literally is under attack. If you do not help your liver, it cannot help you. The result, liver disease and possibly disorders that could affect other organs. Of course, it is important to maintain a healthy weight in addition to eating a healthy diet and exercise regularly. This was our today video. I hope you will like my video. I hope you will understand my video. If you are watching my YouTube channel Makkah Memories, then here I kindly request you to please subscribe to my YouTube channel and press the bell icon to receive the upcoming notification on my YouTube channel Makkah Memories. Thank you so much for watching my video. Goodbye. Take care of yourself. Meet you in the next video with another good amazing topic. Hello dear viewers, welcome to my YouTube channel Makkah Memories. I hope you all viewers will be fine and doing well. So dear viewers, dear friends, in the previous lecture video I had discussed the function of the liver, disease of the liver, dietary management and prevention, management and prevention in the gallstone. Plus I had discussed different types of gallstone, but now in this lecture video I will discuss the vitamins and mineral deficient and severe hepatic failure, dietary management and liver disease. What that you should eat when you have a liver disease. So I will also discuss this in a detail. But before starting my lecture video, here I kindly request you to please subscribe to my YouTube channel Makkah Memories and press the bell icon, plus like my video and share it with your friends and audience. So vitamins and minerals which are deficient in severe hepatic failure. There are 17 vitamins or and minerals which are deficient in severe hepatic failure. These are vitamin A, vitamin D, vitamin E, vitamin K, vitamin B6, vitamin B12, folate, niacin, thiamine, zinc, magnesium, iron, potassium, and phosphorus. So these all are deficient in a severe liver disease. When the deficiency of these vitamins and minerals occur in the body, then it will lead to a very infectious stage of the liver, which is called hepatitis or cirrhosis of the liver. So dietary management and liver disease, here is my main topic of this video, that what diet you should eat when you have a liver disease, and what diet you should not eat. You should prevent yourself from that diet, so that to reduce the risk of the liver disease or decrease the efficiency of the liver becoming more severe. And people with badly damaged livers, protein are not properly processed, waste products may build up and affect the brain. Those people which have damaged liver damage occur due to different types of toxins, different types of drugs like alcohols, etc. So due to any cause, if a person has a damaged liver, so it will not properly process the proteins. So if you are eating a diet which have a high quantity of proteins, then your liver will not process this protein in a very efficient way, and due to this your waste products formed and this metabolism of the proteins are stored and built up in the brain, which can also affect the brain and causes different severe condition diseases of the brain. So dietary changes for liver disease may involve cutting down the amount of proteins you eat. This will help limit the buildup of toxic waste products. If you have a liver disease and you are still going to consume proteins, then you should cut down the amount of protein you eat. Then the build up toxic waste product in the brain reduces. This will reduces the risk of different types of diseases. So another type of liver disease is cirrhosis. So basically cirrhosis is the scarring and hardening of the liver. So for cirrhosis, the diet management I will recommend a very amazing diet to you, that you will have to follow this diet in your daily routine to prevent the severity of the cirrhosis. So diet recommendations limit salt and foods that contain a lot of salt. If you have a cirrhosis, mean you have a scared or hard liver, then you should eat food which have less amount of salt and contain a lot of salt. So you should eat a food which have that contain a lot of salt. So you should have to consume more salt. Talk to your doctor about how much protein to have in your diet. You will also doctor will recommend you that how much protein diet you should follow in your diet. General dietary tips for cirrhosis diet. Here I will also just told you about the some general diets you should follow when you have a cirrhosis. So these diet, you have to avoid alcohol, you have to reduce fat intake, avoid undercooked or raw food, increase the quantity of food you eat, plus you have to eat vegetable, fruits, cooked food, eggs, low fat yogurt, lean meat, nuts and seeds, nut butter, dried legumes, oats, olive oil, ginger and garlic, coconut water, guava, fresh herbs and fortified milk. What not to eat in the cirrhosis? You should not eat raw meat, red meat, fast food, processed and packaged food, canned food, buttermilk, hot dogs, oils rich in trans fat, broccoli, bread and pancake, sea salt and table salt, alcohol, soft drinks and coffee. You should avoid these things. Reduce the amount of salt you consume, typically less than 1500 milligram per day, as it may worsen fluid build-up and swelling in the liver. Have about 1 gram of protein per kilogram of body weight or less, depending upon the severity of liver problem. So this was our today video about the cirrhosis, dietary management and liver disease. Thank you so much for watching my video. If you are not have subscribed to my YouTube channel Makkah Memories, then here I kindly request you to subscribe to my YouTube channel Makkah Memories and press the bell icon to receive the notification of my upcoming videos. Goodbye, meet you in the next video, another good topic. Hello dear viewers, welcome to my YouTube channel Makkah Memories. I hope you all viewers will be fine and doing well. Dear friends, dear viewers, in the previous lecture video I had discussed a very amazing topic of nutrition, which was nutritional consideration and the prevention and management of the gallstone. Here now in this lecture video I will discuss the function of the liver, diseases of the liver and different types of hepatitis. Stay watching my video on my YouTube channel Makkah Memories. If you have not yet subscribed to my YouTube channel Makkah Memories, then here I kindly request you to subscribe my YouTube channel and press the bell icon of Makkah Memories to receive notification of my upcoming videos. So here I will discuss the function of the liver. So basically liver is the largest internal organ of the body, which have a very important and vital role in the body. It there are around about 8 functions. Here I will discuss which liver perform in the body. Plus I will also discuss seven major important diseases which are occurs in the liver. So function of the liver, first function of the liver is it can metabolize carbohydrates, proteins and fats. We are eating carbohydrates, fats and proteins, so liver can metabolize, liver perform metabolism of carbohydrates, fats and proteins. Like here I am taking this tea, so when I take this tea, then it have carbohydrates